Hello, I would like to show you some specific manual techniques for a knee patient. Sometimes you will find the patient cannot flex the knee. The problem are soft tissue adherences and thickening around the kneecap or below, sometimes on the inner side. So we have some specific manual techniques which I can apply and which I can teach to the patient or family members to work on these soft tissue problems. Getting them more looser and easier, flexion will occur. First technique, just lift up the skin. I grasp deeply in it, skin and soft cutaneous tissue. I just try to lift it up. If it is painful, take it large grasping. If it is no longer so painful, you can do it more narrow, more straight. Try to lift up as if you catch the flesh and you lift it up from the bone. I do it on the inside, the front part above the patella and below the patella. Go down at least into the middle of the lower limb of tibia. We can do the same on the side. Now we were working in a longitudinal way. Do it transversal as well. This will be more difficult and probably more painful. If you can feel there is a lot of thickening really on the surface, then we work with these tiny movements. I just grasp a little bit like this. I catch the skin and I move it. Probably the patient will have a burning sensation. I do the same on the tibia. Particularly when you have pretibial edema or that thickening which we can call the bone blues. In a very acute stage, we are not able to do that, but at least in a subacute or chronic stage, you already do it very intensively. Then I go into the tissue, I pull, I take off the slack and then I pull a little bit more. Deep tissue stretch. Go in, take off the slack and then a bit more. Like this we can stretch out adherences. Slowly I work up towards the hip. Go in, take off the slack, pull. And we can do that more on the inner side. Probably you hold with one hand and then you work like this. The patient can feel a burning sensation. Having done that, we can start skin rolling. I catch a part of the skin, subcutaneous tissue, and then I'm rolling it from the outside to the inner side. Having worked a lot on the tissue, you can roll from the hip towards to the knee. This is a very intensive technique. The tissue has to be prepared. Now we are coming to the kneecap. Before mobilizing the kneecap, I just massage the tissue around. Just go really on the level of the bone and massage on the side the tissue. Try to to make it soft by little circles. A few times you move up and down, and on the lower part work with that type of grasping. If Hoffa's fat body, that part here below the knee, behind the patella tendon, is thickened, massage a lot and move it, stretch it out, make it flexible. Having done this work, we can start with patella movement. Doing this patella movement, we stretch out tissues and adherences. Transversal movement and craniocaudal movement like this. Very often you will find pain on the inner side of the knee. Take it off like this. Or spiral movement. With this hand I pull down like this, with the other like this. And I just go into, I pull on the tendon, semimembranosus, semitendinosus tendon, I pull them up. I stretch out that tissue on the inner side of the knee. Having done that in a full extension position, you can start to do it in slight flexion. Maybe you put your own knee on it and then you do the same techniques. The tissue will be under more tension. Doing the technique, it will be more intensified. While going towards flexion, do the stretching from the knee down to the ankle. I grasp firmly, take off the slack, and then I pull. While doing knee flexion, the tissue has to be flexible here. It has to be flexible here, and it has to be flexible here. So we work a lot on this tissue flexibility before we really go into the mobilization of the passive flexion movement. That's all.